we have been working on the modelling now for several days and working with experts to understand the experience not just here in New South Wales but in fact overseas. Look, modelling is complex and we'll explain that more after the press conference, but the point is that we take a lot of factors into consideration. And included in that, of course, are case numbers, but there's a lot more to it than case numbers. At the moment, we're looking at the conversion rate to hospitalisations here in New South Wales. So we've got our own data now to work through. And what is interesting in that data is that we are seeing a much lower length of stay associated with people with Omicron who do end up with a hospital admission. The point about that, though, is it still places a very significant degree of stress on the health system because people moving in and moving out and moving in and moving out takes a lot of work for our hard-working health staff each and every day. There is some positive news that we're starting to see emerge in this, though, and that is we're measuring the conversion rate between cases as we know them and what that then translates to in terms of hospital admissions, and that conversion rate is coming down. So it's a very important factor that we're continuing to monitor each and every day as we move through this period, and we'll continue to look at this and measure the actuals. What you will see there are three different scenarios. The scenario which we consider the worst case scenario at present on the information available to us has been modelled on the experience in New York, taking that into account and the factors that apply here. The middle line is the line that we think is the most realistic of the three at the moment. And that takes into account our own experience here in New South Wales. It considers factors such as the health of our population, our vaccination rates, and a lot of inputs to result in that curve. And as I mentioned earlier this week, what we see in these curves is that they rise sharply and there is also a relatively sharp decline. Based on this information at the moment, and again, it is a model and we will need to continue to monitor it, we believe by the middle of February we will be certainly well past the peak of this, and we expect that peak to occur in around the third to the last week of January. So we reiterate, we have got some challenging weeks ahead of us. But we have been planning for this pandemic and continuing to reinvent ourselves for 2 years now. Omicron has thrown us a fresh set of challenges. It's thrown our health staff a very significant fresh set of challenges. And none the least because of the impact on furloughing and the fact that our own health staff are personally affected by this. We've been working with the private sector now for a long time, and one of the positive outcomes of this pandemic is that our two systems are as close together as they've ever been. We briefed our private hospital colleagues yesterday about the changes that we need to make to get through these next few weeks. And while we've made changes to elective surgery and we talk about non-urgent surgery, can I be clear to those people on the receiving end? It is not a decision that we take lightly. It is not something that we consider unnecessary surgery, and we appreciate for every single person on the receiving end of those phone calls, it creates distress. What we've demonstrated previously is that when we've had these surgical slowdowns, and it's slowed down at the moment because of the Christmas New Year period, we have managed in our system to work very hard, again, along with our private hospital colleagues, to catch up as fast as we can. We will continue to make those efforts, noting that we have a health system that is very fatigued. But I did want to express to people that is not a decision that we take lightly or that we see it as just a simple tap that we turn on and off. We do not consider it in that way. Moving to the boosters, we obviously are working also very hard in our vaccine clinics, as you know. As the Premier's mentioned, by the third week of January and toward the end of January, pending our workforce, we certainly are aiming to be back up around the 300,000 doses a week. We will be contributing to the rollout for 5 to 11-year-olds across the state, but we note that the bulk of that work will be done in GPs and pharmacies as it was for the 12 to 15-year-olds. Nevertheless, our clinics, our vaccination clinics, have played an incredibly important role during the entire vaccine rollout and will continue to do so. And this week has been great to see the numbers lift. We were around 16,500 on Tuesday. It's been over 18,000 the last 2 days, which has been great to see. Can I echo the words of both Dr Chant and the Premier? We thank our health system right across the board, public, private, GPs, pharmacies and everybody involved in this effort. We will get through this and we will continue to make sure we work hard to support our system as we go forward. Thank you.